wife, Evelyn, who is an amazingly smart engineer who has taken care of our disabled daughter for 22 years. And I would like to thank Lauren and Mara and Arthur for inviting us here today. I'd like to thank the Israel Cancer Association for the incredible support of cancer research that is impactful. And I took a look at the list of people who are funded, and those are all incredibly important projects that are described. I'd also like to thank Arena and Peter, Donald, Phyllis, Nellie, who are all sitting at our table, who I had the pleasure of meeting today. So I am a professor at Brown, founding director of the Legorreta Cancer Center at Brown University. I'm an American Cancer Society professor. There are about 50 of us in the country. I'm a spokesperson for the American Cancer Society. And one of the things I do in that role is whenever I'm speaking at an event like this, is I will say, I see a few people, probably more than most in the audience, who are over the age of 45. And so I just like to remind you to get your colonoscopies. I am a practicing physician scientist. I specialize in colorectal cancer as well as precision oncology, which I'll talk a little bit about. And I see plenty of patients in my clinic with advanced colorectal cancer that's metastasized, often because it wasn't detected early when it was curable. And you'd be surprised how much of a problem that is around the United States, including in rural areas and inner cities. I am also here as the chair of the WIN Consortium in precision oncology. And I'll tell you a little bit about precision oncology at the end of my comments, because I think this is the future of oncology. I've also started 4 companies to bring new treatments to patients, and I'll tell you a little bit about that. So, for over 3 decades, I have been doing research on a gene called P53, the most commonly mutated gene in human cancer. Sometimes it's inherited in a syndrome where it runs in families and people get multiple cancers, and we really don't have any way to treat it or prevent it at this point. And so in the field, I'm known for 2 things. 3 decades ago, I was training at Johns Hopkins, and I discovered a gene that I called WAF1, which has some similarity to my first name, Wafik. I got away with it. Nobody cared what you called a gene 30 years ago.
Exactly.
But it turned out to be important because it's how our cells stop dividing when they're under stress or exposed to radiation or chemotherapy. And so, for years I thought this would be the most important thing I would ever do, because it is important. But thankfully, there is life after such a discovery, and our research connected P53 to the innate immune system. And that research eventually led us to find a drug that boosts the innate immune system. And 19 years later, last August, that drug was approved by the US FDA, the first ever treatment for an aggressive middle of the brain tumor with a specific mutation known as H3K27M. It's an epigenetic drug which can turn off genes and turn on genes, just like you were talking, Brian. And, you know, I didn't wake up one day thinking, let me discover a drug that treats brain cancer. So I've been asking a lot of questions. You know, why did it turn out that way? How can we combine it with other drugs to have effects through the immune system in other tumor types? And, you know, that keeps us busy. So this is an exciting time in oncology, and I'm going to spend the rest of my comments talking about precision oncology. So I go around the world championing precision oncology as the future of oncology. You know, when a patient with advanced cancer goes to see the doctor, they talk about standard of care, they talk about clinical trials, but then there's precision oncology. And I think this is what any of us would want for ourselves, our loved ones. And it's really about what makes those tumors tick and how can we combine drugs to treat these tumors. Now, one of my colleagues, Dr. Razel Kurzweil, who's the chief medical officer of this nonprofit, says if you look at the number of cancers, the number of targets, and the number of drugs, and you want to do clinical trials and all of these combinations, it'll take several thousand years. And patients just don't have time to wait. And so one of the ways that the WIN Consortium helps patients, and I co-chair a regularly running molecular tumor board that reviews cases, all of their genomics, all of the tests, and it's really been eye-opening in terms of the lengths that people go to with testing, with therapy options, looking at vaccines, looking at CAR T therapy, looking at how can we combine drugs to treat these cancers. And really what the consortium does is brings together the experts in a certain area, and we come up with suggestions that go back to the doctor, the treating doctor, to consider and to try and make it happen. But this is based on actual data, that it's something called matching score. If you combine targeted agents, the more targets you get at for a given cancer, the better the overall survival of patients. And it's been shown for 16 years now to be the case. You know, the consortium is interested in having global impact and doing innovative things. And some of that includes data around the world, you know, about different cancers and how genetics and environment influence them, and how the drugs work in different settings. And those are things that we can get at. The consortium is also interested in artificial intelligence and digital pathology to have impact in underserved areas. So imagine, and the technology just keeps getting better and amazing. Like just from a section of a tumor, stain 5 minutes, you know, a H&E stain. AI can now provide a 3-dimensional image of all the genes that are expressed there, just from what it sees under the microscope. There's also something known as functional precision medicine, which can be done when a biopsy is taken, it's grown as organoids from a patient's tumor and tested against drugs, and sometimes the results are surprising. A good example was a patient in the New York area with metastatic melanoma to the brain who didn't respond to immunotherapy. The biggest breakthrough to help patients live longer with melanoma in the last close to 20 years. They had functional precision medicine, and the results suggested a leukemia drug, not something anyone would have come up with, and the drug helped the patient. So we would love to collaborate with the Israel Cancer Association. We have relationships with academics, with other nonprofits, advocacy groups, the American Cancer Society. There are a lot of challenges with access to testing and access to drugs. So, you know, we care about those issues and would like to do something about it. I will end with, I had open heart surgery at the end of July, 8 hours at the Brigham and Women's Hospital. My heart was stopped for 3 hours last July 30th. They had to shock me to help me wake up. And the next day when I got up, there were wires in my heart, there was a balloon in my leg, and I had gained 40 pounds. And I was sitting there and I said, God was in the room. I didn't see God, but I didn't see the surgeon either. But I wrote a book about it last August that you can find on Amazon that describes what I was going through at that time. And there's a lot of other interesting stuff in there about how we support science, and so I won't give away what's in the book. But thank you very much. I will end with the American Cancer Society predicts in 2026 there'll be well over 2 million diagnoses of cancer and over 600,000 deaths, despite every advance that has been made. And so we need to support research, and I think we should all be grateful, and do get your checkbooks out to support the Israel Cancer Association that has been making a difference for a very long time, and this will continue with your support. So thank you very much for your attention, and I'm happy to answer questions.